We're fortunate in that we've been here with such good community support that, we were able to be open more days a week and see more patients.
So it's a good charity to donate to.
It is a good charity.
Consider making a donation to the free medical clinic.
Yes, you can do that. Tax deductible.
Tax deductible. I kind of wonder with this recent healthcare plan, I know it's going to take some time for it to get implemented, but what kind of discussions has the free medical clinic been having in regards to the new healthcare plan?
Well, I think that people assume that, well, if we get healthcare reform or whatever it looks like or sounds like, that then we'll go away. For whatever ever happens, there's going to be a huge unmet need for doctors. I mean, there aren't enough doctors now to see people in different parts of the country and in our state and rural areas and things like that. There's going to be a huge unmet need, and so maybe we'll turn into some other kind of more community clinic or something like that. I just don't see us going away. We just may not be a free clinic as we are now.
You'll evolve in some way.
We will evolve in some way.
So what's the average free medical clinic patient like?
Well, we see men, women, we see people of all ages really, but primarily sort of a middle-aged person maybe that works. They may have a part-time job, they may have 2 part-time jobs. We have actually in the past 6 months seen an increase in people that haven't had to use the clinic before. They're new people to us, and I think that holds true in many of the services. Like the food bank, I know is having a real increase in people that have never had to use the service before.
Social services are being stretched across the board, it seems.
Yeah, and so that tells me that when people say that unemployment hasn't affected Johnson County as much as some other places. Maybe these people are all coming from other places, but that we've seen a big increase in people that need the services that have never had to before, and they're working people that work in low wage jobs around our community, maybe in temporary employment or something like that. They just don't have insurance.
Yeah. Well, they're saying in Johnson County it's not as much unemployment as underemployment, so that makes a lot of sense. If you kept your job but your hours have been cut or your pay's decreased, then I can see how their needs would go up.
Well, and again, you hear it all the time on the news and everything about the increase in people with diabetes and hypertension. It's true. I mean, we're seeing more and more people that have those problems. And that I think, if you realize that soon enough or before you become really ill, that's a good benefit there, so that, they haven't had to use other health services that maybe are more expensive or emergency rooms are just not a good place to get your primary health care.
So what kind of volunteer needs do you have here at the clinic?
Well, physicians, the professional volunteers are the ones that we need most. So physicians, nurse practitioners, physician assistants, pharmacists, phlebotomists, dentists, people that are licensed to provide healthcare services to people.
And is this an opportunity for people who are studying in the medical field to come and get training at all? Or?
Well, we have a position called a patient guide, and we don't have very many of those positions, but a lot of people that have an interest in maybe pre-med or something like that have volunteered in those positions. And we need receptionists and just daily volunteers. Sometimes I have a lot of little jobs that people can do to help me as well, just administrative kinds of things. And they can apply online. You can go to our website, www.freemedicalclinic.org, and apply for those positions online as well. The professionals do apply for liability coverage through the state of Iowa's Volunteer Healthcare Provider Program, and that's a program that we help them through the paperwork process to make sure that they have everything done that they can volunteer here then.
Great. Well, is there anything else that people in the community should know about the free medical clinic?
Well, that it's a great service, and we rely very, very heavily on our local donors and you know, people's goodwill to really maintain the services that we have. And while you know, healthcare reform is in the air, that doesn't mean that we still don't need some help to keep things going until things are better.
Great. Well, that's good to know. That in the meantime, we should keep supporting the free medical clinic. Well, thank you so much for sitting down and talking with me, Sandy.
Hey, thanks, Katie.
And this is the Mayor's Monthly Notable Nonprofit. If you want to learn more about the Free Medical Clinic, go to freemedicalclinic.org. Thanks for watching.
Community voice. I you a city is 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 na 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 I you a city is I you a city is I you a city is I you a city